Hey guys, how you doing? Welcome back. We're doing now lesson 8 of our journey through the Hunt Fundamentals of Care learning workbook. We're going to be talking about skin care and body care in this module. So right now everybody should be at lesson 1, which is page 154. Ooh, we're making progress. Look at this. All right, first lesson talking about skin care. And the objectives here, by the time we're done with this lesson, you should be able to understand how to promote healthy skincare practices, including hygiene, nutrition, hydration, and mobility. You should know how to continuously observe someone's skin for signs and symptoms of breakdown or injury or some sort of condition. You should know how to use personal care practices that promote and maintain skin integrity for yourself and also for the client, and demonstrate critical steps like using assistive devices and common care practices to turn and reposition someone in bed. Also, you should know how to identify risk factors in skin breakdown and recognize pressure injuries, taking appropriate action when able, if they are developing or appear to be developing a pressure injury, and recall when to report skin changes and who to report them to. All good things, all things you should know how to do by the time we're done talking today. All right. Some keywords we'll discuss as we move through this module. Dressing, not salad dressing and not dressing clothes. We're talking about a wound dressing here. And that's the protective covering on the clothes. It could be called clean. It could be called sterile. There's different ways of addressing it, but it's just something that covers a wound and helps it to heal. Nurse delegation, that's when a nurse, a licensed registered nurse, says that you are okay to do a specific task with this client in their home. The nurse comes out, they train you how to do it, they make sure that you do it, they watch you do it, they sign off that they say, yep, this person knows how to do it. That's nurse delegation. There's a process you have to go through to get to even the point that you can become nurse delegated, and we'll discuss that later in another module. Pressure injuries, you just need to know that they are skin breakdowns or injuries caused by pressure or friction. That is what causes them, is pressure. Okay? Now there's a number of ways that pressure can occur, and we're going to go over those as we talk through the module. Pressure points are places on the body where pressure is most likely to take place. Places where they bear weight or the skin is thinnest and pressure is put on these areas often, such as the elbows, the knees, or the hips, or the buttocks, places like that. Then there's self-directed care, which we talked about before. That's the client's right to direct their own care and say what services they want and what way they want them done. We already talked about that one, so you should know that one. And skin breakdown and skin integrity is basically just, how the skin deteriorates or breaks down over time and things that can speed up that process. And skin integrity basically just says that the skin has integrity and it's not broken or damaged or in any way, it's whole. But you can also measure skin integrity in varying degrees, saying that it's, thin or it's thick or it's healthy or it's unhealthy. So knowing the word integrity is important in relation to skin. The overview. Skin is a vital organ of the human body. We have an important role in promoting and maintaining the skin's integrity. Many things you can do can help keep someone's skin healthy. And we also have to be routinely observing their skin and knowing what to look for and document and reporting. Remember, I told you before that the skin is like the body armor of the body. It keeps out most of the things that would invade and infect and harm the body. Okay, so keeping your armor up to date and polished and shiny and nice and strong is definitely a good idea for any warrior going into battle. Let's jump over to page 155 now. Okay, let's get into just skin in general. What is skin? Skin is the largest organ of the body. It's the first line of defense to heat, cold, and infection. We talked about age and chronic illness making it so that the skin can become thinner and drier, and it doesn't heal quite as easily. When you lose that layer of fat just below the skin, you start to get cold more easily, and it makes it harder to regulate body temperature. So one minute you're going to be cold, the next minute you're going to be hot. That's something that happens as that layer of fat disappears. Sweat glands will lose the ability to cool the body, which is why people start feeling hot. And the loss of ability to feel pain, heat, or light touch, it's a decreased sensitivity. So maybe you're tapping someone on the shoulder and they just don't feel you. their skin isn't, the receptors in the skin isn't transmitting the information correctly. Okay? Now, promoting healthy skin. 5 ways to keep the skin healthy. Number 1, keep the skin clean. Number 2, keep it dry. Number 3, use moisturizing creams and lotions, which seems to contradict number 2, but it's a little different. I'll explain how. Number 4, encourage good nutrition. And number 5, encourage mobility. Okay? Those are the basic 5 tenets of good skin health. You should know these. You should maybe write them down. You should work on having those in your head just in case the test comes up with some questions about these 5 items. Now, keeping the skin clean involves all areas of the skin and around the skin, including hair, nails, beard, all those areas of the outer layer of the body. Routine bathing is important. You don't necessarily have to bathe your client every single day or shower them every day, but depending on how much they sweat, how much activity, how often they go outside, how regular they are with their bowel and bladder movements, how clean they maintain themselves, when they're not. That's kind of what will dictate how often you need to, help them with their showers and bathing. Okay? At bare minimum, I'd say everybody should have a shower or bath once a week. Okay? And that's at bare minimum. But most of the time, you're going to do at least a couple of times a week for most people. I find showering and bathing enjoyable. I like it. I feel good. I wake up in the morning. I take a nice shower. It wakes me up, refreshes me for the day, makes me. Most people enjoy showering and bathing. But as I told you before, remember, talking about those falls, sometimes clients that used to enjoy showering and bathing, they don't like it anymore because it's scary for them. So if someone's fighting you on taking a bath, it's not always because they don't want the bath. There's something else going on there. Now, keeping the skin dry, you can use pads or briefs that absorb urine and keep moisture away from the skin. So basically, adult diapers can help when you're helping somebody get cleaned or changed. Using pads to put underneath them to keep their skin dry during the process, and also protects the surface that you're cleaning them on. It does say avoid using blue pads, and I don't say avoid using blue pads. I say avoid leaving a client on a blue pad for an extended period of time, but don't avoid using them. They're useful for the purpose of, getting something under somebody for a barrier protection and making sure that they stay dry through the process, and the area under the area you're cleaning stays fairly clean and dry as well. So blue pads do serve a purpose. They're just not meant to be on the client at all times because they don't. They're not very waterproof. They're not very. They don't allow for airflow. They're too airtight. Waterproof cloth pads are better. Something that can be laundered and used. If someone's incontinent and they've been letting their bowels go multiple times throughout the day, and you want to keep a pad under them, the cloth pad is the way to go, not a blue pad. Now, using lotions, obviously you want to, there's a star here, and I'm not sure why there's a star here because down here it says some tasks are not permitted. So I guess the star refers to if it's a lotion or cream that says prescription and there's specific ways it has to be applied, you wouldn't do this. But if it's just a regular old, hey, I just want some lotion, and they grab a little bit of lotion and it's just regular old, cocoa butter, whatever, and you squirt it on your hands, put it on their arms or their legs or whatever, that's perfectly fine. Just stay away from the prescription stuff unless you're delegated to work with it. Encourage mobility. Remember, we talked about mobility and getting around and moving around and making sure that you're staying healthy. And also, of course, good nutrition. Hydrated skin is healthy skin. Good nutrition will help the skin to stay strong and thicker and healthier. And all good tips. Now, the things that aren't permitted, talked about the prescription meds, but also, so applying or changing a Band-Aid, that's totally fine. What they can't do is change sterile dressings. I was looking at the Band-Aid confused for a second. I'm like, yes, we can do Band-Aids. Okay, yeah. Sterile dressings, that's something you wouldn't be doing. That's a nurse-delegated task. Or prescribe lotions or ointments, again, nurse-delegated tasks. We will talk more about nurse delegation later. Come with me now over to page 156, and we're going to observe and report some skin problems. Whenever you're doing personal care, this is a good opportunity to observe the client's overall skin health. We don't want to be weird or creepy about it. We don't want to be staring or looking or asking invasive questions, but you do want to be paying attention to the client's skin and looking for any evidence of breakdown or anything like that when we're doing personal care. Okay. We're going to take a quick break, and we're going to come back and talk about some skin problems you might be able to identify. Okay, so identifying some skin problems. You might see pressure ulcers. These are skin breakdown or injury caused by pressure or weakened skin that damages the skin and underlying tissues. They're staged or classified by how deep they go and the damage that they cause. Stasis or venous ulcers are open areas caused by poor circulation in the blood and veins. You might see a rash or scaly red area. You might see skin around the ulcer becoming discolored or reddish brown. And this is normally going to be seen in the lower legs and feet. Arterial ulcers are round open areas on the feet or lower leg due to lack of blood flow to the legs. And rashes and infections, we kind of know what rashes are, right? They're raised, bumpy areas on the skin, and a lot of times they're itchy. Skin infections are a break in the skin, and then you might see like oozing or like a bacteria or fungus or something where there's a discoloration. Burns are the damage that skin takes when they're damaged by the sun, fire, chemicals, anything hot, or electricity. Okay? Burns are classified according to how deeply the skin is damaged. First, second, and third degree burns. Okay? First are the least serious, third are the most serious. And you're not required to classify burns for the test. Don't worry about that. Just know that there are 3 classifications for burns. Now, with skin cancer or lesions, they're normally abnormal growth. And usually they don't spread and they're treatable. But there's a dangerous kind of skin cancer called melanoma. That one's irregularly shaped and would be like a strange mole or like a mole that's changing. If you see your client have a strange mole that they didn't have before, report that to the supervisor right away. Okay? Especially if there's any kind of like pain in the area or itching in the area. If they complain about, oh, this bothers me, and you look and there's a mole there and you don't recognize the mole from like, a month ago. Something like that. So be looking for any of those signs or symptoms, redness, swelling, changes, skin breaks, rashes, any odors or pains, anything that might be reporting. Good to keep an eye on. Over now to page 157. 157, talking about pressure injuries. Now, pressure injuries are very common among older adults. They can be painful and debilitating, and they can lead to serious and even life-threatening conditions. This is one of those ones where if it gets bad enough, you can die. Okay? It's heavy, heavy, heavy in the spectrum of not so bad to really serious. It's over here in the really serious column. Okay? Now, the causes of pressure injuries are, number one, the immobility and the pressure. So not moving, causing steady, unbroken pressure to an area, minimizing circulation, minimizing blood flow, and causing deeper and deeper and deeper abrasions of those tissues. That's how pressure ulcers happen. So if they lay or sit in a position without moving, that pressure builds and builds and builds. And oftentimes it's from the bone inside the body pressing on the skin, and then the surface of what they're sitting on pressing on the other side, and it's squishing that poor skin and that muscle and that tissue so badly that it can't get any blood flow. And if there's no blood, there's no oxygen, then that area of the body begins to die. Okay? And that's where the skin breakdown occurs. The amount of pressure that's needed for a pressure injury varies. It can be a small amount or it can be a long amount. There's really no set amount of time that's a dangerous time. It's just use good judgment and make sure your client is turning and moving regularly. Okay? Pressure injuries also can be caused by skin weakening from friction, like you drag them across something or pull or scrape or something's twisting across their skin. We talked about the braces before. When people wear braces on their legs all day, pressure injuries can occur from those braces being on them all day. Even though they're therapeutic and they're measured specifically for them and they're supposed to wear them, those braces can still cause pressure injuries. Too much moisture on the skin can also weaken the skin because the skin gets too moist. It has to have a good balance of moisture and dryness to be perfectly good. Think of it in terms of leather, for example. If you soak leather in water, it's going to eventually get soft and spongy and fall apart, won't it? But if you dry leather in the sun for a long time, it's going to get hard and crack. Well, leather is essentially skin. It's made of the same exact type of thing. And so that's the sort of thing you have to be thinking about when you're dealing with people's skin. Too much moisture is a bad thing. Over lotioning is not good. Dryness and cracking, obviously the opposite end of the spectrum. Malnutrition or dehydration, that leads to skin breakdown from within. So the skin may not be thinning from outside, but it's thinning from inside. Okay? Certain chronic illnesses or diseases also, especially ones that limit circulation. Maybe they're the healthiest person in the world and they exercise and they eat well and they do all the things they're supposed to do. They may have a disease that affects them and makes their skin break down. Sometimes there's nothing you can do. Now, the people that are high risk for pressure injuries, if you have a client that falls into any of these categories, they're somebody that you should especially be checking regularly when you're doing skincare or any personal assistance for skin breakdown. People in wheelchairs, people who maybe had a pressure injury in the past, someone who's paralyzed or who's incontinent, someone with poor nutrition, dehydration, a chronic illness like diabetes, someone who has cognitive impairments that just doesn't know that they need to be moving, someone who has a decreased ability to feel sensation. They may be developing a pressure sore and don't even know it, even though it's open and bleeding and oozing wound. Someone who's very obese, or someone who's very thin, because thin people have much less padding to support between the bones and the skin. You know what I mean? So thinness or too heaviness, either one can be bad, causing pressure sores. Now over here at the top of page 157, you'll see the pictures of what the pressure sores look like. Okay? Not too graphic, but still fairly clear as to what we're talking about there. The first sign that there may be a pressure sore occurring is that there's redness or unbroken skin lasting 15 to 30 minutes or more with people with light skin tones. People with darker skin tones, it might look red, purple, blue, one of those colors. And if in doubt, just compare it to the exact other side of the client's body. That's the great thing, is most people have 2 arms, 2 legs, 2 sides to a body. So if you see their elbows looking kind of funny, well, look at their other elbow. See if it looks the same. And if it does, then okay, that's probably just a normal skin tone. And if this one's real red and this one's real pink, maybe there's something going on there that needs to be observed. So if you see this, the best thing you can do is you keep an eye on it. You remove pressure from the area immediately, you keep an eye on it, and you see if the swelling, if the redness, if the change color, if it goes down, if it goes away. If it doesn't go away, but it doesn't get worse, that's not a good thing. That still means that there's a pressure ulcer occurring. It's just under the skin where it hasn't actually broken the skin yet. So you'd need to report this and get this looked at right away. If it goes away and the skin goes back to normal skin color and there's no other signs or symptoms, then you can assume that it was caught on time and the circulation's resumed and the person's probably okay. But you also need to remember to be extra vigilant in the future, since the person has exhibited the ease at which they could get a pressure ulcer, haven't they? Other things like the texture changing, maybe an open area that you see. If you see an open area and there's actually, like, you can see inside of their skin, then okay, they've already got a pressure ulcer. Or if the skin feels mushy, that could be another case where it's like, yeah, it's too late now. The skin's mushy, it smushes, it's not firm, it doesn't bounce back like it's supposed to. That's another sign that that area under there is basically dead and it's not recovering. It can also look like a gray-black scab, and beneath the scab is the pressure injury. A lot of times, what this will be is that the person had a pressure injury, it tried to heal, but it didn't heal properly. All that healed was the skin over it, but the damage under it is still present. So if you see a gray or a black scab, that can also be indication that someone has a pressure injury, it's scabbed over. So still, report, document, and get treatment. Now over to page 158. These are some pressure points. See those nice people sitting and laying down and everything? When you're sitting or lying down, these are the pressure areas that you're likely to be exposing and most likely to getting pressure sores in. Okay, folks in wheelchairs, these are the areas they need to worry about. People who spend most of their time in bed, these are the areas they need to worry about. Okay, so know and observe and understand these areas and make sure that you're checking these areas regularly if you have a client that's very non-mobile. If you see a problem, make sure, like we said, you reposition them off the area and remove pressure. And then if it doesn't go away right away, you document it, you report it. Don't massage the area of the skin around it. The last thing that an area needs is more pressure. And don't use like a heat lamp or a hair dryer or something that dries the skin out, thinking, oh, the skin's really soft and spongy. Maybe it's too wet. No, no, no. Don't do that. And don't put lotions or creams on it because that also can break down the skin. So in short, don't do anything but remove pressure and look at it. Okay? All right, let's take a quick break. Then we're going to come over to page 159 and talk about turning and repositioning. Whew, okay, we're back. All right, now we're talking about the skill turning and repositioning a client in bed. We should be now on page 159. Okay, 159. So let's change the page there. All right, so for turning and repositioning a client, you need to be turning them frequently to protect their skin. Remember we talked about if someone's lying in bed for long periods of time in the same position, that's where the risk of pressure sores can occur. So making sure they're turning, shifting, moving, whatever it may be, at least every 1 to 2 hours is going to be important to maintain good skin health and avoid those pressure sores. If a client's able to move themselves, shifting their weight, it may be just something simple as just to remind them, hey, make sure you turn over on your side for a little bit, or hey, don't forget to shift your weight a little bit. Just reminding them to do it, not necessarily having to do it for them. But sometimes someone can't get up or move or do anything at all, and you'd have to help them with it. So usually there'd be like a schedule. You'd set like a little alarm or a little timer or something that just, gives you a little ring every couple hours when it's like, oh, hey, time to turn them, something like that. If someone's confined to bed, it should be every 2 hours. If someone's in a wheelchair, they should be shifting their weight in the chair at least every 15 minutes for about 15 seconds, and try to change position at least every hour. Now, how do you change your position in a wheelchair? Well, basically what it is you're shifting your weight. That's kind of what it boils down to. You lean back a little more, you lean forward a little more, you scoot up, you maybe brace your feet, whatever you can do to get some of the weight off of the areas that are currently bearing weight. Okay? It's just not a great idea to be sitting in a wheelchair all day long. Wheelchairs, they try to make them as comfortable as they can, but they're not the best thing in the world. They're really not meant to be sat in all day long. Okay? You should be using the wheelchair to transfer people from one place to another. We're going to get you from bed to your easy chair or something, but a nice soft recliner that can be adjusted and moved and legs raised and lowered, and much better than sitting in a wheelchair all day. So while it may be convenient to leave your client in a wheelchair, in the long run, it's not the healthiest choice. So unless they have to be in that wheelchair for therapeutic reasons, I would recommend using the wheelchair as you would any other assistive device, and only use it when it's needed to get someone where they need to go. Okay? All right, some general tips to remember when repositioning people. Make sure there's room in the bed to roll the client. Okay? We're going to talk about turning and repositioning in class, and I'm going to explain all these concepts and why they're important and show you in real time how to completely perform this task. All right? There's a lot more that goes into this, but that's the biggest one, is make sure that you don't roll them off the bed because you start from a bad place and end in a bad place in the roll. Now, skin friction. Friction is caused when skin is rubbed against or dragged over a surface. Even some slight rubbing or friction can cause a pressure injury. Remember, people's skin are very fragile, very delicate, and the older they get, the more fragile and delicate their skin usually is. You have to lift, not drag when transferring, or if you're using a draw sheet, then you make sure they're on the draw sheet, and then you can drag them because you're dragging the draw sheet, not the client. It seems like so you're splitting hairs there, but it is a difference. Make sure they're positioned in bed or chair correctly so they're not sliding down, and they're on smooth linen or clothing, because wrinkles, even wrinkles in the clothes or the blankets, can add an extra layer of pressure to a part of the skin that could be sensitive or susceptible. If they're lying on a bed and there's like a special mattress that has foam or air or gel or even water, that could be used. And a doctor case manager can help a client get special equipment if they need it. Something that'll help to make sure that they don't get the pressure ulcers, and something that'll help them to sort of stay in place when they're positioned. Don't use any donut-shaped cushions because they reduce blood flow and they cause the tissue to swell. You might think, oh, well, if they're sitting on this, there's just one area that's causing them pain, so we're going to have them sit on this donut that doesn't put any pressure on the area. Well, great. But what you're doing is you're putting pressure on all the other areas around it, and you're causing blood to pool and coalesce in that area. So you're actually worsening the situation. The donut cushions are not used for people who have fragile skin or skin breakdown. A donut cushion is used for maybe someone that broke their tailbone and their tailbone's healing and they just can't sit on it. Something like that. But not for people who have bad skin condition, because you're going to make it worse. Make sure that whatever position they're in, it spreads weight evenly and that it's all supported well, from head to toe. Okay? Don't have them leaning or sitting or at an angle where the pressure is all kind of pushing onto one area. Pillows under their legs and other things that support areas that might be unduly pressured or that can take pressure off areas can be used as well. So maybe find a way to use some pillows to help support your client too. That can be good. The weight of the blankets can cause pressure on top of the bed. Some people have pretty heavy blankets, comforters and things. So bed cradles can be used as well. And these will help air circulation, helping the feet dry. I don't have an air cradle here. I don't even know what one is, to be perfectly honest. But if they have a bed cradle and they want you to use it, then I advise you to learn how to use it and figure out that method. Go ahead and turn with me now to page 160. Yeah, it's very rare that I come across something I've never heard of, but I've never heard of a bed cradle before. Now be cautious about raising the head of the bed. This puts more pressure on the tailbone and it allows the client to slide, increasing the risk for the pressure injury. So they may want to sit up in bed for a while, which isn't necessarily a problem, but you wouldn't want to have them sitting up in bed all day long, right? Because that puts the sliding and the pressure right there on that tailbone. Lying flat could also be a problem for clients that have difficulty breathing. So you might have to raise the head of the bed, but try not to raise it more than about 30-degree angle. About like that right there. You don't want it up at like 60 degrees, and you certainly don't want it at 90 degrees. About 30 degrees is about as high as you want to go. There'll still be some extra pressure on certain areas of the body, but it won't be as excessive, and it'll be easier for the client to turn and shift their weight if they're not laying or sitting in a straight up and down position. Okay? Avoid positioning the client directly on the hip bone also when they're on their when they're on their side. And you can use tuck pillows to go behind their back when they're in this position to minimize the pressure on the hip. We'll show you how to do those in class too. So in summary for this first lesson, promoting and maintaining healthy skin is essential for good health. You are responsible for promoting and maintaining the healthy skin in the client and recognizing skin problems before they become problems, don't you? In particular, you're supposed to recognize the pressure injuries and take appropriate action, safely repositioning them to prevent it from worsening and documenting and reporting it to the proper people and helping them get treatment if treatment is needed. Okay? You might have to call their doctor. Maybe they don't call their doctor. Maybe you have to call the doctor. You might have to help them get treatment for something. So be prepared for that. Don't be afraid. Don't be nervous. Oh, someone's going to blame me because they have this pressure ulcer. No, someone's going to blame you because you didn't report it. You knew about it and didn't report it. That's when you're in trouble. If it occurs, it occurs. You do your best to solve it. But, don't hide it or, worry that someone's going to get you in trouble because they got a pressure sore. So, all right, at the bottom of page 160, let's go through the checkpoint questions, and we're going to just answer the questions like always. Put your answers in there, bring them to class. We're going to discuss them, talk through them, go over them, and we'll take care of that. So I'm going to take a quick break. We're going to come back here, and we're going to begin at lesson 2, body care. Bye.